Hi, I'm Nancy Gremley, Health Program Coordinator with the Catholic Schools. As a registered medical technologist, it is my pleasure to talk to you about bloodborne pathogens and exposure control. If you have any questions about these topics, please contact me at the Diocese of Kansas City St. Joseph Catholic Schools office. Before we start, please take a moment to sign and date your training roster. Make sure you have access to your school or center's bloodborne pathogens exposure control plan and complete the pre-test. You may take the test now. Welcome back. If you are watching this, you are either a new employee, your school or center's exposure control plan has changed, or it's been a year since your last training. This is your bloodborne pathogens exposure control training. A bloodborne pathogen is a microscopic organism that is present in human blood and can cause disease and death. The viruses we are speaking of are hepatitis B, hepatitis C, and HIV, the human immunodeficiency virus. These can be transferred through exposure to blood and body fluids. The most common way of exposure is through sex or sharing needles with an infected person. However, because of your job, you may have occupational exposure to your eyes, your nose, your mouth, and your skin through open cuts, nicks, acne, dermatitis, piercing of your skin, or abrasions. It is your employer's responsibility to minimize these risks of occupational exposure to bloodborne pathogens. This is a federal law. It provides for training you in bloodborne pathogens, in the use and access to personal protective equipment, work practice and engineering controls, and good housekeeping techniques. This also includes offering the hepatitis B vaccine. It requires procedures for post-exposure follow-up. All staff that is designated as risk by your job description is covered by OSHA bloodborne pathogens regulations. Staff not designated at risk and volunteers are not covered by this law, but they should be trained in universal precautions. Again, someone who is considered at risk is an employee who, through their job description, may reasonably anticipate having skin, eye, mucous membrane, and or parenteral piercing of your skin, contact with human blood, and other potentially infectious material during the performance of your job duties, regardless of the frequency of that contact. The job descriptions vary from school and center. They may include teachers, secretaries, your health room coordinator or staff nurse, your aides, your principals and directors, and your maintenance and janitorial staff. The viruses, again, are hepatitis B, hepatitis C, and HIV. Hepatitis B may have no symptoms, flu-like symptoms, or may cause extreme illness. It can cause liver inflammation, cirrhosis, cancer, and death. It can live dried and at room temperature for a week. There is a vaccine available to help reduce the chance of contracting this disease. Hepatitis C may also have no symptoms to flu-like symptoms to extreme illness. It also can cause liver inflammation, cirrhosis, cancer, and death. It can live up to 4 days dried and at room temperature. There is no vaccine available to reduce the chance of contracting this disease. There are medications available to treat this disease, but they are very costly and very hard on your body. HIV. Again, for a while, you may have no symptoms to flu-like symptoms to extreme illness. You can again go several years without symptoms. HIV can lead to AIDS and cause death. HIV lives only a very short time outside of the body. There is no vaccine available to reduce the chance of contracting this disease. There are medications available to reduce the symptoms. They are costly and hard on your body. There is no cure. Exposure control is the use of personal protective equipment, work practice and engineering controls, and good housekeeping techniques. They are to minimize the risk of your exposure. You should use standard or universal precautions with all age groups, all people of every socioeconomic class, whether they are rural, suburban, or living in urban environments. Personal protective equipment is defined as specialized clothing or equipment worn by an employee for protection against a hazard. Therefore, your general work clothes, your uniforms, your pants, your skirts, your blouses, are not intended to function as protection against a hazard and are not considered to be personal protective equipment. Each school and center has personal protective equipment located with its first aid supplies. All staff is provided personal protective equipment for your individual use at sites where children and students are likely to be in need of first aid, in your classrooms, in your gyms, in your playgrounds. Each school and center can provide its own personal protective equipment. The standards, though, are gloves, Band-Aids, face masks or face shields, some sort of eye protection, antibacterial towels, plastic bags, and aprons. Make sure you contact your supervisor to restock your personal protective equipment. When you use gloves, you need vinyl, non-latex, in your size for single use only, and make sure they're not damaged. Maintenance and janitorial staff may use rubber gloves that have no physical flaws. Never use cotton or wool gloves or any that can be soaked through. Make sure you remove your gloves properly. Do not touch the outside and dispose of them properly. Also, make sure you wash your hands as soon as possible in a downward position with a non-abrasive soap and running water. Dry with disposable towels and dispose of the towels properly. If you don't have access to running water, then you may use antiseptic towelettes or antiseptic hand cleanser until you can get to soap and running water. If you touch your eyes, your mouth, or other mucous membranes, make sure you flush them with running water. Other personal protective equipment would be gowns. You need to use plastic to protect your clothing. If your clothing is soiled, you are supposed to leave it with your supervisor to be laundered. Use face shields if you will be in splattering face shields to keep splatters out of your eyes and nose. Use only once and dispose of properly. Work practice controls are controls that reduce the likelihood of exposure by altering the manner in which a task is performed. In other words, it prohibits the recapping of needles with a two-handed technique. Again, do not recap or bend or reuse contaminated needles or other sharps. Other work practice controls include covering your cuts and wounds with a bandage before putting on your gloves, minimizing splashing, splattering, and generation of droplets. Do not eat, drink, apply cosmetics or lip balm, or handle your contact lenses where there is a reasonable possibility of exposure. Do not have food or drink in your refrigerators, your freezers, on your shelves, in your cabinets, or on your countertops where there is a reasonable possibility of exposure. Do not touch your eyes or your mouth or your nose before washing your hands. Engineering controls, such as sharps disposable containers, self-sheathing needles, safer medical advices, isolate or remove the bloodborne pathogens hazard from your workplace. Some of these controls include disposal of sharps in a designated sharps container, disposal of glass in a puncture-resistant container, and always place your contaminated used items in a plastic bag. Secure that bag before disposing in the common trash. Some good housekeeping techniques are to wear your gown and your gloves and your mask as needed to clean the area. You have to clean the contaminated surfaces with an appropriate disinfectant, such as a 10% bleach solution. Bleach must be used within 24 hours of mixing. Dispose of soiled articles in the appropriate container. Disinfect mops, pails, cleaning tools, and waste bins. Trash. Always double bag in plastic any bloodied articles or used personal protective equipment. Always wear your gloves to collect your trash. Do not smash or overfill it. Carry it away from your body. Clean your cans and bins with an appropriate disinfectant. And again, wash your hands with soap and running water after handling the trash. Accidents happen. Keep your personal protective equipment with you at your location, in a travel pack, anywhere an incident can occur. When you have an incident, think first before helping. Place barriers between you and the blood or body fluids. Use any plastic, vinyl, something impermeable to keep the liquid away from you. If it's a minor situation, you can have the person cover the blood with their own hand, such as a bloody nose or a cut knee. Always apply pressure to the site, but avoid contact with the blood. If you contaminate your eyes, your nose, and your mouth, flush with running water. Again, if you contaminate your skin, wash with soap and running water. If you provide CPR, always use a CPR resuscitation mask. If one is not available, you can do compressions until a mask is available or EMS arrives. If you have an exposure, and the exposure incident is defined as a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's job duties, whether or not you used your personal protective equipment, your work practice and engineering controls, and good housekeeping techniques, you are still entitled under this law to post-exposure evaluation and counseling. First, you have to report it. You must report the incident by the end of your work shift to your principal, your director, or your supervisor. An incident report must be written. You will be sent to a workman's compensation physician. Your principal, director, or supervisor will file that report with Human Resources in the diocese. Hepatitis B vaccine. All employees who may reasonably anticipate exposure must first be offered the hepatitis B vaccine pre-exposure. This is cost prohibitive to take care of all employees. So OSHA accepts as a less serious infraction not offering to all staff. However, first aid providers and nurses must be offered the vaccine pre-exposure. All employees with an exposure incident will be offered the vaccine in the post-exposure follow-up. If you have already received the hepatitis B vaccine, please inform your supervisor. In the evaluation for your post-exposure, your supervisor will provide the workman's comp physician with a copy of the OSHA standard, written description of your duties as they relate to the exposure incident, written documentation of the route of exposure and circumstances of your exposure, documentation of the source person if known, and medical records including your vaccination status. The physician will provide to you hepatitis and HIV testing of you and the source individual if known. The physician will also counsel you on conditions and treatment options. The employee, you, will be told of the hepatitis and HIV status of the source individual. Then the physician will provide to your supervisor within 15 days a statement that you have been informed of the results of your evaluation, a statement that you have been told of medical conditions that result from exposure and that may require further evaluation or treatment. Your medical records of this incident are kept for the duration of your employment plus 30 years. They are kept on file with the school, the center, or the diocese. Those medical records are yours, and they are available to you if you request it. These training records are kept for 3 years. This is your law. You have access to it. The law and your exposure control plan are kept in your principal or director's office. You may obtain a copy of the law and your plan by request to your supervisor. Please review the specifics of your school's plan now. Please review the specific of your school or center's plan now. Before we take the post-test, let's review proper glove removal. When you have finished using your contaminated equipment, place in the center of your contaminated glove. Without touching your skin, gently remove the glove over your fingers, being sure to not touch your skin. Take the ball of that glove in the ball of your other hand, and again, without touching the outside of your glove, just gently pull that over. You now have all of your contamination in the ball. Put this in plastic and then double bag before putting in the common trash. You may now take a few moments to complete the post-test. Okay, good. Here are the answers to your post-test. Number 1 is true. Number 2 is false. The standard only protects employees, but volunteers should be trained in universal precautions. Number 3 is false. Training for all employees is for all employees who may reasonably anticipate skin, eye, mucous membrane, parenteral or piercing of the skin, contact with human blood, and other potentially infectious material during the performance of their job duties, regardless of the frequency of such contact. Number 4 is false. Training occurs at the time of initial assignment, when changes occur to the plan, and annually thereafter. Number 5 is true. Number 6 is true. Number 7 is false. HIV dies with exposure to air. Number 8 is true. Number 9 is true. Number 10 is true. Number 11 is true. The standard states employees must be offered the vaccine pre-exposure, and schools may do so. However, local OSHA administrators expected only post-exposure. Nurses and first aid administrators must be offered the hepatitis B vaccine at employment, according to the Missouri Department of Health. Number 12 is false. All blood should be considered infectious. Number 13 is true. Number 14 is false. The center or school is responsible for the cost of the post-exposure evaluation and follow-up. Number 15 is false. The only information available to the director or principal is the healthcare professional's written opinion, which includes whether or not the hepatitis B vaccine is indicated for the employee, if the employee has received that vaccine, a statement that the employee has been informed of the results of the evaluation, and a statement about the medical conditions that result from exposure to blood but may require further evaluation and treatment. The physician cannot give your supervisor results of your evaluation. Number 16 is true. Number 17 is false. You can use clean rubber gloves, single-use vinyl or latex gloves, and again, they need to be clean and in good condition. But remember, many people are developing an allergy to latex, so vinyl may be a better choice. Number 18 is true. Number 19 is false. The responder may be exposed to blood during the procedure, so you have to use a mask. Number 20 is true. Please give your completed tests and your roster to your supervisor. Have a great year.